Well, this is yet another attempt to make a video of this talk for the right length of time. It's I'm talking about an n much smaller than p problem. It's actually a small data problem because n is 40 and p is, well, there's two spreadsheets involved, 40 by 40 spreadsheets. The number of covariates, number of columns can be made much bigger if we take account of nonlinearities and interactions. And it's about corona sickness, and it's about hydroxychloroquine, which is the miracle medicine which Trump has been promoting, and President Macron in France has been promoting, which is actually an a well-known old anti-malarial medicine. And the idea is that to get given together with an antibiotic and azithromycin, and possibly supplemented with zinc supplement, it could have a useful role as a prophylactic measure, which means to say a medicine you give to people who fear they are becoming ill and which may stop them from becoming very ill. Okay, now I'm talking from slides. The slides are on my home page. Here's the location of my home page at the University of Leiden. And this is the file I'm taking you through some of the pages of right now. At the moment it has 30 pages, which is much too long for 10 minutes talk. I want to show you about 10 of them, and the other 20, sorry, provide some material which I'm going to put into paper which I'm writing at the same time. Let's get going. I did not do this work on my own. It got started through a collaboration with this lady, Laila Schneps, who's actually a pure mathematician from Paris, and we have a common interest in forensic statistics and in the use of mathematics and statistics and probability in legal cases, especially murder cases. And she got fascinated by the work of the Marseille group, Didier Raoult's group, who are the ones who promoted very strongly at the beginning of the corona pandemic this medication, this treatment. Philippe Gautret is the lead author of a number of the publications coming from Didier Raoult's institute. They worked together with a single statistician, but he was actually a medical doctor, a young medical doctor, Hoang van Thuan. I'm not quite sure if I pronounced this properly. He's a medical doctor. He's doing a PhD in Marseille. He comes from Vietnam, and he's becoming an epidemiologist. We have been working with him, and he with us, and also I've been aided by this young man, Dipro Mondal, who's a master student in statistics in Leiden, and he came to me interested in doing a summer project, and he's been doing some very interesting things which are not finished yet, so they will hardly be mentioned in these coming 8 minutes, but I hope I will be able to tell more about his findings and what he has done, what he will have done when we have the Zoom discussion of this current presentation. I got a lot of help from a lot of other people because I was learning a lot of things myself which I'd not done before. Okay, so here's the idea. We're looking at a situation where many people may fear they have corona. Some people have been exposed to people with corona. Some people may be feeling some initial symptoms which may be corona symptoms, and they go to their doctor and what should the doctor do? Gautret and his colleagues, Rao and various other people, will say take hydroxychloroquine, and it may stop the disease from progressing at all, so you may never reach the stage of having that autoimmune reaction when your body starts destroying your own heart or lungs or brain by mistaking your own tissues for alien tissues. Now, a back of the envelope calculation, which I'm not going to do right now because there are some numbers here and we have to get them right, or make some reasonable guesses and then do some reasonable correct calculations. But it's clear that from a back of the envelope calculation that we would need 1,000, if not 2,000 patients to distinguish between the situation that 1 in 8 of such patients in normal circumstances is going to get seriously ill. 7/8 not going to get very ill anyway. They may become asymptomatic spreaders of the virus, and they may get mild symptoms and have a little flu, be better in a few days. Okay, 7 in 8 don't get seriously ill. And it may be the case that this medication reduces the chance of 1 in 8 of getting seriously ill to 1 in 16. That would be a medically very significant result, and the calculation shows we would need about 2,000 patients to be able to see that definitely decide one way or the other. Well, at the moment we don't have that, as I will say later, but in particular we have at the moment 2 times 40, which is not very much. 2 publicized early trials, a trial and also just experience of a doctor in the south of the Netherlands. They had spectacularly good results for this treatment, and of course because they were spectacularly good they were publicized and indeed even published, and I suppose that there were other persons who had bad experiences and who we never heard about. Okay, let's have a look at the Marseille data, which led to a paper which officially came out in August, but actually was already available as a preprint in I think in April, if not already in March. And there's a long list of authors, and as mentioned, they have one epidemiologist among them, who is a very young Vietnamese person who did some simple statistics, of which I will say more in a moment. If you go to that paper, you can distill this 2x2 table from it, and there are 26 patients who got the treatment and 16 who were control. And many of the treated patients got better. They didn't have any disease after 6 days. A reliable test suggests they had no infection anymore. Of the control patients, most of them were infected after 6 days, and of course many of them went on to have very bad outcomes. The standard 2x2 table analysis has a p-value of 0.5%, n is 42, big odds ratio of about 10. It looks very favorable for the treatment, but one should be careful. It looks as though there's a big difference between the 2 groups, because actually the treatment is confounded with treatment location. The Marseille patients all got the treatment, and the control patients are coming from Nice and I think also Aix-en-Provence, from nearby clinics, and they appear to be similar. Again, some 2x2 tables suggest they're not very different in the t-test, but they could well be different patients. So in the paper things are worse, because 6 patients are removed because they did not comply with, they did not complete the treatment. 2 patients got so sick so early they were transferred to intensive care in other hospitals. 2 patients got bored and left, and they were having a little bother with the side effects of the treatment, and they weren't ill anyway, so they went off home. So there are only 36 patients, and the p-value is even better, 1 per mil. But this is very misleading, I think. Now, one thing I did was a standard modern Bayesian analysis for 2x2 table, a slab and slice prior, using the JASP package, or you can also reproduce it in R. We start off being somewhat skeptical and assigning a 5% chance that the medicine does anything whatsoever. 50% chance that there's no difference between the 2 groups. The 2 groups are 2 samples from the same population. And with 50% chance there could be a real difference in either direction. Well, having seen this data, we are still 8% confident that there's no difference between the 2 groups. So if we believed there were no difference in advance, the data does not shake our conviction very much. It certainly reduces it, but there's still a good chance that we just have 2 samples from the same population. In male, the situation is similar, and I will go past this very fast. The data actually looks more extreme, looks even more favorable to hydroxychloroquine, but actually the Bayesian conclusion is less favorable still. A posteriori, there's 12% chance that we just have 2 samples from the same population. Now, we actually have two spreadsheets, roughly 40 by 40, with 40 covariates, including comorbidities, age and sex, and symptoms of those 2 times 40 patients. We know what are the symptoms of corona nowadays, and they are being noted down for those patients. We know what are dangerous health situations to be in advance. You better not have Alzheimer or have a heart problem. Old age is bad, and being a male is bad. Possibly other things are bad as well, but we didn't measure them. But we did measure about 40 confounders, and we have them. Now I'm going to skip a few slides and get to what we did. Well, first of all, we tried the obvious things, which is we did logistic regression, and we even used lasso to try to do model selection. But the sample size is just too small to get any sensible results, and it's summarized on the slide here. Because of time, I'm going to not say what is written here. Please read it. The data fits our expectations, but is not able to get anything useful out of it. Now, I do have an idea, and that is that we do know a great deal now, and it seems to me that we can use existing data sets and existing experience to summarize the effects of all those 40 covariates into just 2 variables, one of which would be your corona effective age, and one of which would be the progression of your corona infection if you have it. And at the moment we are busy trying to compute such variables from the data which we have, and of course extracting a recipe, 2 recipes from existing publications. That's what the DeepPro is doing at the moment, and initial results are very promising, but I don't have anything to tell you today. I hope I will have to be able to tell you more in the Zoom discussion when we go live. Well, so here's some conclusions. We badly need a big randomized clinical trial with a sample size of 1,000 or preferably 2,000. 2 groups of 1,000 would be wonderful. We know a great deal more, so we should be able to analyze such data very effectively. And of course, if we do have such large sample sizes, then we can let that data itself teach us what is the effect of age and sex. But I have no doubt we will recover what we already know by now. The last 9 slides, which you can find on the web page, are some pictures of some people and some links to various papers. One to a trial which is very inconclusive results, and one to a trial which is just starting, which may in a couple of months give us the results which we need in order to come to a conclusion. So I'm going to stop here, and I'm looking forward to the conference and hearing people's discussion and joining in. And now I'm going to press the